Hello, today is November 14th, 2020. My name is Aricia Flores. I'm interviewing Claudia Baez of the University Library Special Collections and Archives at the University of the Texas Rio Grande Valley, here hereafter abbreviated at UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Baez, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with Voices Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and or other documentations you're willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you done to special collections and archives at UTRGV. Because we are not conducting this interview in person, and you need to record you consenting to make sure you agree with our interview procedure before we continue. So I ask you a series of 6 questions. Please say yes, I agree, or no, I don't agree after each question. The first question is, do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and materials at the UTRGV University Library?
Yes, I do.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provided?
Yes, I do.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet, where it may be viewed by people around the world?
Yes, I do.
Do you grant the University Library Special Collection and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interviews on the internet?
Yes.
As you recall, we previously filled out a pre-interview form. We use information from the pre-interview form to help research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to UTRGV University Library Special Collections, we would have stripped out any contact information for yourself or family members, so that would not be part of your public file. Your public file will only be accessible to UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in the public file available to the researchers at UTRGV University Library Specials and Collections Archives?
Yes.
On occasion, UTRGV Special Collection Archives and Voices receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number or email with journalists with?
Yes.
Thank you for your consent. Your experience and your story means a lot at us at UTRGV Special Collections and Archives. I look forward to what you have to say in the interview questions. I will now ask. Ms. Byers, thank you for taking the time to meet me. Like I mentioned earlier, what you have experienced is very valuable to us at the UTRGV Special Collections and Archives and the Voices Project. This project is committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley, and those individuals who work with them in an interpersonally during this pandemic. Because you are a director/caregiver who cares for children of essential workers who have to do their part in providing for this community during the pandemic, I'm well aware you have a profound story and experience to share on how COVID-19 has impacted you. So before I ask you to share your stories, by your daycare. Tell us, what encouraged you to open up a daycare center?
Um, Thank you for this meeting. Well, little history about myself. I've been a director for the same facility, for my own facility for 20 years. Um, I went to UTB when I was very young, like your age maybe, and I went into the early childhood field, and my dad at that point helped me out, open up a business, and from then on, I've been running my daycare for the last 20 years. But I know I don't want to get ahead of myself, but we had never experienced nothing like we did this year that we dealt with COVID and making so many changes to our facility.
Thank you. So I will be moving on to your personal understanding of COVID and the first encounters. So my first question is, when and where did you first hear about coronavirus?
I would say when it came out on the news, the kids had gone out for spring break, and then we learned that they might not go back to school after spring break. I have children of my own, my personal kids, so we were like, okay, but they don't want the kids back in school, so we try to make all these adjustments to try to keep the center open for the children that need it, to continue taking the kids to daycare and waiting for all the CDC guidelines that we needed to follow to keep everybody's safety.
Yeah. And what was your honest reaction when you heard that a virus all the way from Asia made its way all the way here to South Texas?
At first, I thought it was a hoax. I didn't really think that had happened. I mean, you're talking that we hear this in March. I had just traveled to Mexico in February. I had gone to another country, been through planes, been through everything. So I didn't think that. I was like, well, we just have to do, we just have to follow rules. But I didn't honestly think that this was actually gonna last this long.
And when you heard about this in March, when did you understand the seriousness of COVID-19? Where wearing a face mask in public seems as silly at first, but it became a major must.
I think until we started seeing cases in our local area, when we started hearing that the hospitals were getting full, that people around that we knew had gotten COVID, that they were sick at home. Well, I had, and, and, um, and then we didn't know what to do with the people, honestly. I have a cousin that she had COVID back in March, and I didn't know what we were supposed to do, when we could hang around with a person again, or that person was going to be contagious forever. It's something that we had to learn through time.
Mhm. And has the media made any sort of influence as to how you perceive COVID? And if yes, are there any media outlets in particular that you get your sources from?
Uh, Since because of my the nature of my business, I try to rely myself on the CDC. I don't like to get all the propaganda from people like the pros, the cons, the government is ruling you, nothing like that. No, I have to follow what the CDC is telling me, what the state is telling me, because I have to think for my business and I have to think what I have to follow.
All right. And you said that you mentioned earlier that people close to you had gotten COVID. Have you come across, do you or the people you commonly come into contact with share the same understanding of the virus? Or the people who take it more lightly or heavily towards it?
There's people that we've come across that I've seen posts on social media that they do not believe in the mask and that it's carbon monoxide or so. I believe it's a safety, but I mean um, that it's something. It's everybody's opinion. To me, I'm not gonna go to a store without a mask because I don't want to risk myself bringing that virus home to my family or taking that virus back to my business. So I have to take all the seriousness of the nature until something else comes up.
All right. And moving on to your business, can you describe where you work and provide some detail about your daily duties at your job?
My business is I own a company called Little Big Ones Daycare. I actually have two centers, but I'm the director at one of the facilities. I'm the director. I basically run the show there, make sure that everything's going on. I'm the person that has to be hearing what CDC says and making sure that my staff is getting training and is aware of what's going on, and that we're following and implementing all the new guidelines to ensure the safety of our children.
All right. And for your daycare, when was it that your daycare started to enforce wearing a face mask?
I'm gonna say that since March, since it started, they told us to start wearing the mask, and we really didn't know, so we started using the mask. I remember trying so hard to obtain masks at that point. Right now, it's very easy to get a face mask for the staff, but trying to find somebody that would make the cloth mask or something. But since March came around, we had to find a way to make sure that we wear the mask.
And Ms. Baez, did you experience any pushback from parents who did not desire to follow these enforcements? And if yes, how did you respond to them?
I haven't. Surprisingly, I haven't. All the parents that have been taking their children know the seriousness of the matter, and plus their safety. They worry about their kids while they're at care. So if we tell them, you know what, your child needs to wear a mask, they kind of are. They feel reassured that we're trying to prevent the spread. So we haven't. All of our parents have been very cooperative.
Okay. And has there any been lack of cooperation from the students who refused to wear face masks or were not very considerate?
No. At the beginning, yes, they didn't want to, or they would forget them, and they would have to go back for them. But I think that uh, at this point in time, they already adapted. To them it's a new norm to be wearing a mask, even if they wear it all day. It's something that it's not something like, why do I have to wear it? It's more like, well, you're at school, you have to wear the mask type of deal.
Right. And looking at the ratios, has there been a change in how many kids attend daycare now versus prior to the pandemic?
Yes, definitely. I miss all my kids back at daycare. I have two facilities with 50 kids each. Right now, we're taking care of 15 to 18 kids per facility. So definitely, it's a big difference. I'm used to seeing my 4 classrooms open. Right now, a lot of people are still working from home, and not everybody has returned. So we're working with whatever, serving the needs of the people that really do need daycare.
All right. And has there been a change? Oh, wait, no, I'm sorry. Were parents allowed to come inside frequently, or was there a new routine for entering and exiting the daycare?
No, since this happened, there was a new CDC guidelines. In our facility, where we don't allow parents inside. Um, Basically, when they come in, they must be wearing their mask, and they outside of the facility, the child comes in, and we do like a screening on the child, and then we let the parent know, you know, why, yes, your child has a screening, and by the screening I mean like temperature. We do a health checkup, and then we let the child wash their hands, and then they can go back to class. But no parents has come into the facility since then. We miss those parents too inside, but we have to do what we have to do.
All right. So going on to the screening, it's under my understanding that prior to COVID, if the child felt ill or showed certain symptoms, they were asked to go home or to the doctor so they can return healthy. With the pandemic, are there any regulations that may prevent a child from coming to daycare, like furthering it?
Uh, it's from doctor to doctor. That's something that we've been dealing with. But with this, I mean, where you're talking about, this started in March, and then September, October, November came around, and then allergy season comes around. So kids are going to have allergies, and it's not necessarily going to be COVID. So yeah, we have to make sure that we don't just take the parents' word for it that it's allergies. They have to go to the doctor, and doctor needs to know that the child is attending a daycare facility, and if they believe that the child needs to be screened or has been exposed in order to come back, or if they believe that, you know what, no, this is just severe allergies, the child suffers from allergies, and I mean, they have to have a pre-existing allergy experience, I guess, so that they can allow them. But no diet, we can allow them to be there with any signs of respiratory illnesses.
All right. So does your staff take a COVID test occasionally, or do they take them when they're hear someone they have encountered has tested positive for COVID-19?
They are taking it if they get exposed, or if we hear somebody that if any exposure, if they start feeling sick. I mean, during this time, I believe most of my staff has gone through several testing, and when they've been exposed to the virus.
All right. And has there been anyone, either staff or student, who has tested positive for COVID-19?
Yes, we have had to deal with it. We have had to close for it. Um, the first time that I had to tell parents that I had to close down broke my heart. I had never closed my facility for. They told me my licensing rep and health department recommended me to close for 2 weeks. I had never stopped working for 2 weeks. I didn't even know what to do with 2 weeks time. But I had to understand that it was for the safety of the children. So, I mean, we had to.
All right. And after you found out that there was a positive, what actions did you take for your facility to make sure that there wasn't any sort of spread that could occur? Like any sort of disinfecting measures did you take?
Well, our disinfecting measures changed completely since this happened. Uh, for example, you know, I'm sure you grew up playing dress up with little princess dresses. Right now, those little dresses are put away. We do not use anything that is cloth. Our dolls that are made of cloth, our emotional dolls that we had, they're all put away. Everything that we use right now has to be disinfected. We disinfect twice a day. If the children use the toys in the morning, we have to go through a whole disinfecting thing during nap time and make sure that the toys are ready for them to use in the afternoons. Toys outside are being disinfected. When there is exposure, of course, we do hire a professional company to come do the spray and make sure that if there's any virus in the air, that we can make sure and terminate it, because we don't want the spread amongst other individuals in the facility.
All right. All right. And you had mentioned earlier that state recommended that you close your daycare because of the COVID-19 positive. Has there been any change in state regulations for managing a daycare now?
It was not state, like the licensing, that told me that. It was more like health department. Health department told me I already had, the thing was that some of my staff came out positive, and they told me, if you're not gonna have the staff for it, you need to close. So I don't know what the process is right now, because I mean, we haven't gone through it. This happened back in July, but if you're lacking staff, you can't just throw anybody inside to take care of kids. They have to go through a whole process of being fingerprinted and being trained to be inside the classroom with the kids. Somebody's grandma can't come take care of the kids. So that was the case. health department mentioned, you know what, if you already had this case and this case, there was 2 cases, it's better if you close down, because if we start seeing more spread, then you can lead yourself into an investigation. I was like, no, you know what, let's just close it out. It has to stop right now. Hopefully right now, I mean, with time, things have been controlled more. I haven't seen it.
All right. So, moving direction in this interview, when was it that you found some difficulties accessing the inventory, and what type of items were difficult to get for the daycare?
Um, Milk, toilet paper, and of course, bread, um, soups. I mean, I had to buy groceries, a whole week's groceries for the kids, and at this point in time, they would only allow you to take one item, and I was like, well, how do I just take one item when I have to buy for a daycare? How do I just take one milk when I usually need like 15, 20 gallons per week? So there was times that I was running in and out of the store. I even had my kids go in and get two, because I needed them for the kids. It was not like I was reselling the milk. It was for the kids at the daycare. So I had to have my children go in and help me out, because they were not allowing more than, I think it was 1 or 2 gallons that they had. And then inventory was low. Everybody was going crazy at the beginning, but we were gonna run out of groceries.
Hmm. Did you ever have to go out of town to pick up anything that you would typically buy at your local store, or did you ever try to order online?
No, no, I did everything locally.
And there wasn't any sort of loophole, because this is a daycare center and you obviously feed more than 5 kids, so you need more inventory. They didn't see any exemption for you guys?
They signed the form that we were supposed to present, but that was not working. I mean, that was like our local grocers would say no, we can't. So they did send a form, but I understand that people could get a hold of that form and could take advantage of the situation. But it was a temporary issue, not for long.
And when COVID did start, did you have any difficulties accessing hand sanitizer, disinfecting wipes, spray, reusable face masks, or even gloves? A little more challenging than before?
You know, it was hard, but it just so happened that in March when this started, we sent out a memo to the parents and we said if they could help out with donations, and a lot of the parents donated things to the facility. We had parents that had, I guess some of them had found the stuff, and they sent us Clorox, they gave us sanitizing wipes, they gave us a hand sanitizer, Lysol. Those were things that I guess when people did, I guess some people got some, and we were lucky enough that parents started donated some to our facilities.
Right.
I'm very blessed to have parents that know the importance that we needed those things and that we couldn't find them, and the parents that had gotten extra stuff actually shared it with us.
Right. And to wrap up this section, can you please share the story of your business and how it's been impacted financially by this ongoing pandemic?
Um, I would say that, I mean, we are not under the hole, because thankfully my business is paid for. I don't rent. It's my own place. So and right now some staff left during the beginning. So that staff that left, I did not hire more people. We just stay with the people. So basically, maybe our income did go down, but we are still doing good. I know we have faith in God that that everything's going to come back to normal. And then when we start picking up our numbers, and I mean, the numbers are going down and the numbers are going up for us as far as enrollment, that we can come back to normal. So for the meantime, I have mixed emotions. Sometimes I'm like, well, do I really want a full facility, knowing that that could endanger all the kids, or do I want to stay halfway and just keep everybody safe? So right now it's just mixed emotions. I mean, I do miss my kids. There's a lot of kids that left because parents were scared, and I wish I could see them. But uh, I guess it will happen when it's time.
Mm. All right, and to wrap this interview up, I just have a couple more questions. Um, when we get past this pandemic, do you believe that the daycare will change in regulations, or do you plan to keep it as it is currently with the face mask and like the constant face mask, the disinfecting between nap time and after the facility closes?
I mean, the face mask, I hope that one day I can see my kids, because we work with little ones. So you're talking about toddlers that we teach them how to speak. So they need to see our facial expressions. So we're hoping that that goes away. Honestly, I mean, that's one thing that I hope that goes away. As far as sanitizing, if they tell us that we have to change this or we have to do that, I mean, there is things that I think that I will never go back to. Like, for example, blankets. There's blankets. I used to allow parents to bring blankets, but now thinking of viruses, I'm like, well, you know what? Forget this. Now the daycare's going to provide blankets, because I don't want blankets to be stacked up with other kids' blanket and then the virus be there or something. So there is going to be a change as far as before and how we continue, but I don't think it's going to be nothing drastic. The only thing I'm hoping is those face masks. Eventually, we can get rid of them, of course, with safety. When we have the proper vaccinations and we know that we're safe to go. But I'm sure you don't really like to be wearing that mask all the time.
No. Are you satisfied with the way Brownsville has responded to COVID-19?
Yes. The mayor of Brownsville has been very active, and since this happened, I mean, I would see his postings and his sharing numbers and sharing information, and you know what, go test here, go test there. So I think that we have been very informed of what's going on and how to prevent ourselves and where to go, and so that we can share up the information. I mean, I don't always need to go test, but sometimes I know somebody that, I mean, I work for my community and they tell me, you know where, I don't know where to go. And at least we know where to point them out.
All right. Were you satisfied with the national enforcements to COVID-19 led by President Trump?
I mean, uh, it was state by state. I mean, I have family in the state of Washington and they closed down their state. So I don't think it was a Trump deal. I think it was a state deal. Some states are more conservative than others. I have family in Washington who say that they don't, in Washington state, who say that I mean, they stayed closed longer than we did. Of course, they are in a colder climate. I think that here, basically, like the island throughout the summer continued open. People would continue going. Concerts, I mean, music was still going on and bars were still open. I mean, what can we do? Everybody has a different opinion.
And by island, you mean South Padre Island, correct?
Yes.
Oh, okay, just make sure. All right, and to move to a little bit political, this year was a historical one, looking at the political perspective. Did the pandemic play a role as to how you voted?
No, no, not at all.
Okay. And my last question for you is there anything you would like to share that we had not mentioned about your experience with COVID-19?
No, I think we pretty much covered all of it. The only thing I would like to say is that that I do believe that it's something that's going to stay for a while, and it's something that from the start to right now, I think at the beginning I used to go to work in fear, and now I feel like I feel a little bit more comfortable following protocols and understanding that this is the way that I have to follow the rules. At the beginning, I guess I had this mixed feelings. I didn't know what to tell my staff. I mean, I am the person in charge, and then I don't know what's going on. I mean, I had to read and be reading in the middle of the night. What do I do? What are other people? What are other takers doing? So I think that right now I feel more comfortable as they're going back to work and seeing kids uh, there at the facility and hoping that everything comes back to normal very, very soon.
All right, Ms. Baez, that wraps up our video for today. Thank you for taking the time to do this for me. I really appreciate it. I hope you stay safe with COVID and that you stay healthy as well, ma'am.
Thank you.
All right, have a good one, ma'am.
Bye.